If ADHD meds are so addictive, why do I forget to take them? So this is a comment that I get a lot in the comment section of any of my videos dealing with ADHD. So are ADHD meds actually addictive? Are they less addictive if you actually have ADHD? What do we know according to science? Now, the focus of this video is going to be on stimulants, so specifically things like Adderall and Ritalin, because these are the drugs that are supposedly the most addictive. And here's why. So Adderall and Ritalin both work on the dopamine system. So they work actually very similar to a lot of drugs of abuse. So Adderall and Ritalin basically increase the amount of dopamine in your system. So they do this either by preventing recycling, so it just stays in the synapse longer and it's more likely to produce an effect, or they can actually do things like increase the amount of dopamine being released or being broken down. But no matter what it's doing, it is increasing the amount of dopamine in your system. And this is very similar to other drugs like blow or crystal. In fact, specific medication for ADHD, like digoxin, is actually methamphetamine hydrochloride, so just a different version of a type of amphetamine. Now, this is why people think that they are addictive, because drugs like blow and crystal are addictive. And it is true. These drugs work in similar ways, so they can be addictive. So how addictive are they? And is it less for people who have ADHD? So yes, ADHD medication can be addictive. Now, I don't like to talk about things in terms of if they can be addictive. Pretty much anything can be addictive. I like to talk about them in terms of how likely they are to be addictive. Are they more likely to cause addiction? And in this case, yes, if they're drugs that increase dopamine, that is more likely to cause addiction. And we see that certain methods of using drugs are more likely to cause addiction too. So things like route of administration. So if you take a drug that has extended release, so it takes a while for you to actually start feeling the effects, and those effects are kind of long-term throughout the day, that's less likely to be addictive. So something that produces faster effects, so kind of the immediate release, that is more likely to be addictive, and that's also more likely to be abused. So people will actually basically use them in other ways, so they're injecting them or they're snorting them instead of just taking them orally, because orally is actually the least likely method to be addictive. And according to our latest estimates, about 1 in 4 people who have been prescribed stimulant medication like Addy and Rit, about 1 in 4 of those will actually misuse it. And about 1 in 5 will actually divert it. So that means giving it or selling it to somebody who is not prescribed that medication. Now, we see that there are certain risk factors associated with if somebody is more likely to misuse it if they're prescribed it. And those risk factors include thinking that it's not risky. So the less risky you think it is, the more likely you are to just abuse it. We also see that if you have other symptoms like depression and anxiety, those kind of comorbidities are more likely for you to misuse the stimulant medication. And we see that if you just have a stockpile at home, so if you actually don't take it all the time, and so you just build up the stockpile, you're more likely to misuse it then too. Now, we don't see that things like sensation seeking are linked to misuse. So if somebody is more likely to just want to go out and like skydive and try out new things, that does not make them more likely to misuse their stimulant medication. Now, what about the diversion side? So what makes people more likely to actually give away or sell their medication? We see that if you use other drugs, you're more likely to divert that medication. And also just having friends that are asking you to give them or sell them their medication, that makes you more likely to give them or sell them their medication. So that peer influence plays a huge role here. And in fact, about 60 to 80% of people who use stimulant meds like Ritalin or Adderall, they're actually asked to sell or give away their medication. Now, my favorite weird fact from all of this is that if somebody is using blow at the same time that they're using stimulant medication, they're actually less likely to divert or try to sell or give away their stimulant medication. Now, they didn't go into why this was. So they didn't go into if it's just because like they're already using a stimulant. So why would they try to sell a different stimulant that's actually kind of less powerful than the one that they're using? We're not entirely sure, but that is a weird finding from that study. Now, on to the main question. Are you less likely to become addicted to these stimulant medications if you actually have ADHD? And the answer is kind of seemingly yes. So the studies show that a lower chronic dose, so basically like the type of prescription that you're likely to get, that does not seem to produce euphoria in people with ADHD. So if you have been properly diagnosed with ADHD, those ADHD meds are not typically producing that kind of high that makes people want to keep using them. And that goes back to this idea of like, why am I just forgetting them if they're supposedly so addictive? There's this idea that you are not getting that same high. You're not getting that same euphoria if you have ADHD. In fact, it is doing things like increasing your focus, and it's more likely to create what is known as dysphoria. So you don't feel great after using it, and instead you kind of feel kind of terrible. And it seems like it's because this chronic low dose that you're getting with those prescription levels, they are not actually causing this kind of rush of dopamine in the nucleus accumbens. So they're not affecting that brain area. And the nucleus accumbens is specifically implicated in things like reward and addiction. So if you have ADHD, you're not getting that like reward from those stimulants. Instead, it is just kind of like increasing your focus and your attention. It is kind of creating these changes in areas like your prefrontal cortex that'll help you with those symptoms of ADHD instead of causing this like hyperactivity and increase in reward that it would normally cause in somebody without ADHD. Now, I really want you to understand that this does not mean that the stimulant medication is not going to be addictive in people with ADHD. That is not what I'm trying to say. I'm trying to say that it is less likely to be addictive. And that is if you are properly diagnosed with ADHD. We have this problem in that there's a lot of different diagnoses out there. Some people are self-diagnosing, and that gets at some of these issues that we see in the literature too. We don't actually have a good definition of what misuse means. So we commonly say it's people who are taking those stimulant medications at a higher level than what they are prescribed. They're taking them with things like alcohol instead of just taking them at their kind of normal times that they're supposed to take them, and they're using them in other routes of administration. If they're using it in a different route of administration, that means that they're misusing the substance, and they're far more likely to become addicted to it. And we rarely ask about this. We also rarely study this in people like children. We are primarily studying this in college students because there are a lot of college students out there who are misusing and diverting their ADHD meds. As a college professor, I can guarantee you that. And then, as I mentioned, we have this self-diagnosis issue. So what happens if you don't have ADHD? You might not have any sort of underlying deficit. It could be that those stimulant meds will actually produce that rewarding effect, and therefore you're more likely to abuse them. But it's also very problematic if you don't treat ADHD. So I don't want you to come out of this thinking like, oh, stimulants are bad, or you should never use them, or stimulants are good, I'm never going to become addicted. That's not the point. This is a nuanced topic. So if you don't treat ADHD, we see that there are all sorts of potentially problematic outcomes. So worse educational outcomes. You have problems typically parenting. You're more likely to use substances. Now, if you treat ADHD, you actually see a decrease in substance use in the future. So yes, there is a worry that ADHD medication, specifically stimulant medication, can be addictive. And that is a thing to think about if you're looking at whether you should take it or whether your children should take it. And we do see that there are ways of decreasing that risk. So not stockpiling it at home, for example. But this is a nuanced subject, and it's not as easy as yes, they are addictive, you should avoid them, or no, they are not addictive, it's not a problem.